name's Frankie Hall, and I'm going to be doing my skills video on placing an NG tube. So I'm going to use what I have to work with here at home. I have my daughter's baby doll, just so I can show you that I know how to measure it, to the xiphoid process, but I'm going to be inserting it with the little nose that we have from our body parts kit. I have my Toomey syringe that I'll use to auscultate and listen. I have a little specimen cup. It didn't specify on our little checkoff sheet to do this, but this one I'll explain now. This one would be, I would use this for whenever I pull back. Once the tube is inserted, I'll pull back and hopefully get gastric content, and then I'll place some into the specimen cup, and I would take a pH strip and test it, and then it's supposed to be less than 5. And then I also have tape, which I've already got ready to go, pulled back and ready to go. I have the little valve that you would place at the end of the NG tube and hook it to intermittent suction at the end. And I have my cup of water with my straw to have the patient hold and drink as I say to swallow, to help swallow that NG tube down. I also have a towel that I would place on the patient to kind of, just in case that they were to get sick or need to spit or what, or any mess is made, rather, keep their gown and everything clean. So I'm gonna start. So I would go into the patient's room. I would introduce myself and explain what we need to do today. I would ask the patient their 2 patient identifiers, name, date of birth. I would perform hand hygiene and put on clean gloves. Not sterile, but clean gloves. And get everything all set up and get ready to go. I would place the patient into like a high Fowler's position. This baby is not cooperating or bending, so I'm forcing it up. So I would have the patient hold the cup and be ready to swallow it down when I'm ready. Okay, so while the patient has a hold of the cup, the patient's not cooperating, I'm going to remove this little NG tube, or Salem sump, rather, that's what this is. And I'm going to show you that I know how to measure this. This baby's not going to sit up and I need both hands, so we'll just do it this way. Normally they'd be sitting up, and I would take this NG here and I would start here by the nose, and I would measure over here near the ear, but not behind the ear, and go to kind of towards the cheek and the back of the throat rather, and hold it there. And I would measure down to the xiphoid process, which is about right here on me. So on this baby doll, it's not even measuring down to the actual marks, but on me, it would be here, and we would go right here, down. Measure down. So on me, it's not numbered. It would go to about to this first mark. Down with the baby. I take and measure. I put this piece of tape right here to mark it. That way we know exactly how far we're going once we insert. So now that we have this, I'm going to have the towel. I'm going to pretend that's the patient now. The patient has his or her water. And we are going to get started. So while we're getting ready to start, we will have the patient kind of set their head back a little bit, and I'm going to start inserting it. Once this gets down to their throat, I'll have them start swallowing the water. And then they'll put their head down like forward like this. That way it'll help go down. So, we're ready to start? Okay, so it's going to be uncomfortable. We're going to get their head back. We're going to go, keep going. All right, now. All right, so it's in the back of their throat. I'm going to have them pinch their nose to their chin, or chin to their chest, rather. I'm going to keep going, have them swallow, 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 swallow. Okay, and we are here. So, now that it's in, I want to take a piece of tape, and I'm going to secure it temporarily while I do other things here. Secure it to like their cheek maybe, so we don't pull it back out and have to do this all over again. This has to stay above the stomach at all times. Once I've got the tape or the NG taped securely to the patient temporarily while I do all this, and before I hook him or her up to suction, what I want to do is take my Toomey syringe. Let's put this over here out of the way. And pull back, and if we are in the stomach, we will get some gastric content. And that is when I would take the gastric content and place some into the specimen cup and use a pH strip to test it. And it's below 5. So, all right, so I've got my stethoscope on, and I'm going to be listening on the stomach, and I'm going to push air back into the stomach. And that is when we are supposed to hear a gurgly type sound. And that's how we know that it is in the stomach. If we do not hear that, then it might be in the lungs. But to confirm placement, we always do an x-ray. That's when we put that order in and do an x-ray. Or they come and do an x-ray. I also need to reiterate, before we do any of this, there must be a doctor's order. We don't just do this all willy-nilly. All right, so then I'm going to take this little valve and hook it up to intermittent suction. It's going to have a long hose to the suction. It's going to be above the patient at all times. I can even take and secure a part of the NG tube to their gown. Let's see. Also, what I like to do is take the tape and split it in half. I take it and hook it to the patient's nose, but it's not wanting to stick on here. And I'm going to take it around. So it's going to be a smaller piece of tape. I'm used to peeling the tape for the size of the patient's nose. These little noses not cooperating. Either way, I'm going to take and kind of go around, crisscross it underneath, and secure it to the patient's nose. I hope it's a little prettier than that. And that is when I would turn on the intermittent suction. Not continuous unless it were to be ordered, but intermittent. And then I would place the patient back down to lowest possible position on the bed and give them their call light, ask if they need anything else, and perform hand hygiene, remove the gloves. Remove the gloves, perform hand hygiene, and leave the room. Something I forgot to mention during the NG video was you need to lubricate the actual NG itself. I forgot because I don't physically have a pack of lubricant, but you need to dip the tip of your NG tube into the lubricant to help ease it back there for the patient's comfort and just for the easier insertion for that, not cause a lot more bleeding than needs to be or rub anything raw. Also, I needed to mention you should always DC, just completely stop what you're doing. If the patient becomes in distress or uncomfortable or vomiting, anything that would prevent you from getting that NG tube down, you need to DC that and allow the patient time and comfort to get a little more at ease, and then make sure you document if you do have to DC that. Also, some patients need something for anxiety. I've personally had to get that before with a doctor's order because the patient knew they needed the NG and wanted to have it done just for the simple fact they wanted to get better, but they just the idea of it and trying to do it really put them at unease, and they get very anxious and hyperventilate. So those are some things that you have to document after and get a doctor's order for, of course. And that's it.